Morris.
Before the last election, the Leader of the House went with me to Rowley Regis Hospital, which at the time had just lost its last 2 inpatient wards. Whilst he was Secretary of State for Health, the hospital opened a new inpatient re-enablement unit and has just announced another ward will be reopening in the autumn. Could we have a debate as we celebrate the 65th birthday of the NHS on the steps the government has taken to ensure that local health services are driven by doctors in partnership with local patients?
Yes, I hope we might. I can't promise an immediate debate, but I do think it is very timely to recognise the work that is done in the NHS. I do remember visiting Rowley Regis Hospital, and if I recall, it's part of the Sandwell and West Bromwich NHS Trust, who I know were right at the forefront of trying to take clinicians taking greater ownership of the services that they provide. If I may say so, Mr Speaker, tomorrow is the 65th anniversary of the NHS. I think universal access to comprehensive healthcare for all at the point of need is one of this country's greatest assets, of which we are rightly proud. I think I want personally to say to the 1 1/3 million people who work in the NHS that we thank them and value what they do. I know, not least from personal experience many times, that they want to achieve the best care for patients, and that was why I put clinical leadership with accountability for quality and excellence in outcomes and care for patients at the heart of our NHS reforms. So to be true to its mission, we need a service at NHS that's envied for its excellence, not just for its availability. That's why the shift from a top-down target culture that covers up failure to one which is open and accountable for outcomes will be a validation of the NHS, not a condemnation of it.